Hey guys, Doc Heps with UroCoach here. So, does it hurt when you've been getting an erection? Well, let me tell you what's going on and how we investigate as urologists. A painful erection can occur in a number of guys. There are two main culprits. It either can be a skin issue or something called Peyronie's disease. First, I'll go over the skin problem. So typically, if there's pain with erection, it's pretty obvious to tell if it's a skin issue. In a lot of men who are uncircumcised, sometimes they have difficulties with the foreskin, either pulling back. There can be some scarring on the foreskin from prior infection, or there's cuts or tearing at certain components or certain areas where that foreskin is attached to the penis, and it can be painful when the skin pulls back. And this typically will hurt when the penis is engorged and erect. So the way to diagnose this is pretty easy. We just do an exam and get a sense of what's going on. If there's signs of infection, oftentimes an antibiotic, either a pill and or a cream or an antifungal cream may be appropriate. If the foreskin is tight, which happens to a lot of guys, sometimes we can use a local steroid cream to try and thin the skin out, and that'll allow the skin to become more flexible in some men so that pulling or tugging isn't as annoying. And that's usually a fairly easy way to solve that problem. The second reason why you might have painful erections is something called Peyronie's disease. So what happens is the lining tissue that holds blood in the penis when the penis gets erect can get a scar. And this scar occurs for unknown reasons. Sometimes there's a traumatic event during sexual activity, but more commonly, the theory is there's multiple areas of so-called microtrauma that causes inflammation. And what happens, that lining becomes scarred in due to that inflammation. During the so-called acute phase of Peyronie's disease, which usually happens over a 6 months period, that there's inflammation and that causes pain. And over time, that inflammation subsides and potentially can cause scarring and a curvature of the penis. Now, that pain with erection is during the acute phase or the inflammatory phase. And unfortunately, there's not a lot to do during this phase. It's not just taking it easy with sexual activity. Anti-inflammatories are generally what we recommend. A lot of men do not eventually develop curvature, or the curvature of the erection that they develop is very mild. So it's not an issue. But occasionally you can find a gentleman that over the 6 month time period, plus or minus, that pain eventually subsides, and then occasionally they can have significant curvature that causes problems. So if that curvature is an issue, there are some treatment options ranging from so-called modeling, bending the penis, there's injections into the scar tissue, and there's surgery. But that's for another video in our Peyronie's disease segment. Painful erections occurs in a lot of guys. Most commonly, it's either a skin issue or an inflammatory issue of the lining, the blood flow of the penis, called Peyronie's disease. Typically, these both can be treated down the road if necessary. The skin issues with either antibiotics or creams. The Peyronie's disease, usually we just use anti-inflammatories, but the pain is self-limiting and usually takes on average 6 months to resolve. So hopefully this provides you some guidance as to why you might be having a problem. Definitely come talk to your urologist so he can help guide you. Thanks for watching. Check out our other videos.